Hello everybody, my name is Eunice Mathis. I'm a registered nurse and the owner of Florida Training Academy. In today's video, I am going to review 70 practice CNA exam questions with answers. Let us begin. All right, number one, what is the most serious problem wrinkled sheets could cause your resident? A bad night's sleep, B, skin tears, C, decubitus ulcers, D, wrinkled sheets are no problem. And the correct answer is C. Wrinkles on sheets could cause pressure on the skin, decreasing circulation, thus causing pressure sores. And another term for pressure sores would be the decubitus ulcer. So that's why we encourage you not to put too many layers beneath your patients and to, of course, have those sheets wrinkle-free. Number two, Mr. Jackson needs help eating. What is the first thing the CNA should do? A, wash your hands and the resident's hands. B, cut the resident's food into small pieces. C, tell the resident where to sit. D, put a clothing protector on the resident. And before you're going to render care, we know the first thing we need to do is A, wash your hands. And you'll also wash the resident's hands before handling food. Number three, Mr. Watson is developmentally disabled. Which of these statements is true? All developmentally disabled residents need help with all of their care. B, they are always unpredictable and emotional. C, they can learn new skills but at a slow pace. D, they always have trouble ambulating. And one of my rule of thumbs is if a question option has always in it, I usually don't choose that one. So let's see what the correct answer is. The answer is C. Each developmentally disabled resident will have different needs, but most are able to learn new skills but at a slower rate than normal. All right, I hope you got that one right. All right, and if you're liking the video, make sure you subscribe to our channel. We try to post new videos weekly, and if you are in the state of Florida, we actually have a facility in Jacksonville where we do in-house CNA training, and that website is fltraining.com, and if you stay to the very end, you'll see that information on the last slide. All right, number four, one of your residents is in traction. Okay, and some of you all may not know what traction is, so I added a photo on the next screen. You should never, A, take the resident's vital signs, B, feed a resident in traction, C, give the resident a bed bath, or D, change the position of the weights. All right, and so this is an image of a patient who's in traction. And so here, they must have had some type of a leg injury that required surgery. And so we have a counterweight down here at the bottom. This is a trapeze, an overbed trapeze. This is what the patient would use to lift their body weight so you can slide the bedpan beneath them so you can change the linens. But as a CNA, you never touch the weights. So the answer for this one is D. The position of the weights can only be adjusted by a nurse or a doctor. Number five, the charge nurse is giving you an assignment. You are not sure how to perform the assignment. You should A, ask another CNA how to perform the assignment. B, ask the charge nurse how to perform the assignment. C, ask the resident how to perform the assignment. Or D, ask another CNA to perform the assignment for you. And it's not going to be D because if it's part of your job role, you have to learn it. And the correct answer is B as in boy. Anytime that you are unsure of how to perform an assignment, ask the charge nurse for help. Never perform an assignment that you're unsure of, therefore putting your resident at risk of injury. Number six, what is the main goal of OBRA? All right, to set standards for safety in the facility. Or B, to monitor the food service department. C, to set up payment schedules for the resident. Or D, to see that the healthcare providers meet set requirements by passing a competency and skills test. And I do apologize. This is my first time really shooting a video since I had surgery. And I think from being, possibly intubated during the surgery, my voice isn't back to full capacity, but I'm doing well. I'm 3 days post-op. So, and I'm back here training my babies who I love. All right, so let's see. Number six is D as in dog. Healthcare providers are responsible for their actions. They need to be well trained in order to give competent care. And so the answer for OBRA, OBRA stands for the Omnibus Budget Reconciliation Act of 1987. And this is a nursing home reform act that was enacted by Congress to protect people from abuse in nursing homes. And so that's when they actually started making sure that we had the proper skills and could perform the skills competently, excuse me. Number 7, when changing soiled linens, what should the nurse aide never do? A, place the soiled linens in the dirty linen container. B, place the soiled linens on the floor. C, wear gloves while changing soiled linens. D, none of the above. What should the nurse aide never do? And you should never, let's go back. I want to look at that one again. You should never do B. All right, so B, soiled linen should always be placed in a dirty linen container and never placed on the floor. Number 8, when helping a resident who's had a stroke, the CNA should dress the unaffected side first, help the resident do everything. C, lead the resident's strong side when transferring, or D, all of the above. So your person's had a stroke, that means that they probably have hemiparesis, half of their body is weak. We don't do everything for our residents. Our goal is to keep them as independent as possible for as long as possible. So I know that B isn't the answer, and if B isn't the answer, that also means that D has also been eliminated. So let's see what the best option is. The answer is going to be C. When someone's had a stroke, the CNA should help the resident begin the transfer with their strong side, and this will facilitate a safer transfer. Number 9, Mr. Jackson is visually impaired. What is the best way to communicate with Mr. Jackson? A, identify yourself before entering the room. B, tap Mr. Jackson on the shoulder and then identify yourself. C, speak in a very low, quiet voice. Or D, teach Mr. Jackson to identify you by your voice. So someone is visually impaired. You want to notify them before you touch them. So the correct answer is A. You always want to identify yourself before entering the room. So you're going to knock. Just because they're visually impaired doesn't mean they're hard of hearing. So knock, get the approval to come in, and then introduce yourself. Number 10, when a new resident is admitted into the facility, what should the nurse assistant not do? Okay, so which one should you not do? A, introduce the resident to the other residents and staff. B, help the resident to find their room. C, call the resident by their first name. D, show the resident where to locate all the call lights. And it's just rude to call someone you don't know, especially if they're older than you, by their first name, especially in the southern states. So what you should not do is C. Never call a new resident by their first name until they've given you permission to do so. 11, the Heimlich maneuver uses abdominal thrust, okay? That's those inward and upward thrust to A, remove a blockage from the airway. B, start the heart beating again. That should be C, get air into the lungs, or D, open the airway. And I have my wonderful assistant who helps me, so forgive us that it says A, B, B, B. We know it's A, B, C, and D. All right, so what is the purpose of the Heimlich maneuver? The purpose is A. The Heimlich maneuver was designed to remove blockages from the airway, and you continue doing that until the object is dislodged, or if the person becomes unresponsive, you'll lay them on the ground, start CPR, beginning with high-quality chest compressions, and of course, call for help. Call 911. 12, to help a resident from becoming dehydrated, the CNA should A, tell the resident to drink fluids only when they are told to. B, provide fresh water and other fluids each shift. C, discourage residents from drinking when they are tired. D, only let residents drink fluids when they are eating. And so if we want to prevent this person from becoming dehydrated, we want to encourage fluids and encourage it often. So pretty much every time you do your hourly check, you'll be asking, hey, Miss Eunice, would you like some water? So the correct answer should be B. Fresh water should be provided on each shift. And as a CNA, as a nurse, I'm just begging you CNAs, just make sure there's always some water in the picture. You just don't know how much our nurses appreciate that. I know you sometimes think that we don't do a whole bunch, but when we have 20 pills that we have to give a resident and then we have to walk back out to turn around to get water, it just, just working with a CNA who understands the full scope and how we work together as a team, we really appreciate, so not only does the patient appreciates having fresh water, the nursing team appreciates the fact that you have put fresh water in your residence rooms also. Number 13, Mr. Jackson has had a small stroke and is weak on one side, but can still support his weight. What is the best device to use when transferring Mr. Jackson? All right, so a mechanical lift is A, B, a sliding board, C, a transfer belt or gate belt, D, you should not transfer Mr. Jackson. This person can still assist you. He can still support some of his weight. So we don't need a mechanical lift. We don't need a sliding board. And of course, we're going to transfer a patient. We don't want them in one position all day. So the best answer is C. Since Mr. Jackson can still support some of his weight, a gate belt can be used in transferring. 14, a coworker said that you broke a client's glasses, which is not true. This is an example of abuse, B, defamation, C, neglect, or D, assault. All right, and so we know it's not abuse. It's not neglect. The patient wasn't injured. It wasn't assault. You didn't hit the patient. So it's going to be a defamation of character. And B, defamation is hurting the reputation of a person by what you intentionally speak or write. 15, the resident has a red and irritated area on their elbow. The CNA should A, have the charge nurse check it as soon as possible, B, wash the elbow thoroughly with soap and water, C, apply lotion to the elbow, D, have another CNA decide what to do. Anytime there is a change in a patient's condition, including the skin, as a CNA, don't apply any soap, don't apply any lotion, you're going to A, we need you to notify the nurse. So the irritated area on the elbow may be the start of a pressure sore and should be checked by the charge nurse, okay? 16, a CNA is talking about her resident in the lunchroom. This is against the A, facilities, policies, and procedures, B, the resident's right to privacy, C, the resident's right to review their chart, or D, none of the above. And you all remember HIPAA. So this is a violation of the resident's right to privacy. Their information should never be discussed in a public area. Again, this violates the resident's right to privacy. 17, the CNA is giving personal care to a resident. She should A, leave the door open to the hallway, B, take the blanket and sheet completely off the resident to make the job easier, C, only uncover the part of the body where care is being given, or D, keep the privacy curtain open at all times. We're not going to leave the door open. We're not going to leave the curtain open. So we know it's not A and it's not D. Let's see what the correct answer is. The correct answer is C. You're going to protect the resident's privacy while giving care, and you're only going to uncover the part of the body that should be bathed. So you're not going to fully pull down the sheet. And plus, when you think about the sheets, they provide warmth and privacy, and our patients are sometimes cold. 18, the terminally ill resident refuses to eat and throws his tray across the floor. She is in what stage of dying? A, bargaining, B, anger, C, acceptance, or D, denial. And the correct answer is going to be B. When a resident is angry for any reason, you're going to encourage them to talk about their feelings. And so, hopefully you understand that that anger isn't directed towards you. This patient just had, a terminal illness recently diagnosed, and they're going to be upset. Okay, try to calm them down and let them discuss their feelings. And of course, notify the nurse as soon as you can do so. 19, it is time for Mr. Blake to have his temperature taken. Mr. Blake just smoked a cigarette. The CNA should A, take an oral temperature after waiting 15 to 20 minutes. B, Mr. Blake's temperature cannot be taken today because he smoked. C, smoking a cigarette makes no difference in an oral temperature reading. Or D, have Mr. Blake drink a glass of water to counteract the cigarette. Anytime someone has eaten, drank, or smoked, you want to do A. it could cause a misreading of the body temperature. So you want to wait about 15 to 20 minutes before you check the temperature to ensure an accurate reading. All right, how's everybody doing? Are we winners? All right, perfect. Number 20, upon entering a resident's room, you find her lying on the floor. What should you do first? A, call 911. B, run to the nurse's station for help. C, try to get the resident into bed. D, shake the resident and ask if she's okay. All right, and so I need there to be more, but the correct answer is going to be D, but while you're shaking that resident, be sure to scream out for help. Because if the resident isn't responding, you may want to be feeling for a pulse and starting CPR. Calling 911. If you're in the nursing home, usually your nurse or whoever comes to assist you can call 911, but we need someone on that chest performing CPR. Imagine if when the paramedics come and someone's in cardiac arrest and the paramedics document that CPR was never started. So if a person's on the ground, you want to be checking for responsiveness and calling for help from your nurse. And the answer is D. When you find someone lying on the floor, you must first assess to see if they're conscious or unconscious. If they are unconscious, call for help immediately. That's according to this question. My rule of thumb, if they're on the floor, you call for help immediately while you're tapping and shouting, checking for responsiveness. And if they're unresponsive, follow everything that you were taught in your BLS or your CPR class to make sure we get blood perfusing to that brain. Number 21, you're getting ready for a job interview. You should A, not wear perfume, B, not wear jeans and a t-shirt, C, not wear a lot of jewelry and makeup, D, all of the above. We know the answer to this one, whether we like it or not. The answer is going to be D. You're going to wear business attire and be very conservative with jewelry and makeup and the style of your hair when you're going to a job interview. And then especially if you're in the medical field, I do a nail check in all of our classes. If your fingernails are longer than the tips of your fingers, they're too long, all right? And so whether they're artificial or your real nails, cut them down because number one, when you're providing care, you can actually cut your resident's skin. And number two, there's germs that are harbored beneath those nails, which you can transfer to another patient and you can cause them to become ill. So when you're thinking about your attire, don't forget about your fingernails also. Number 22, Mr. Jackson has had a stroke. His left arm is very weak. When dressing, you should A, have Mr. Jackson put both arms in his shirt sleeves at the same time. But if one is weak, it's not going to happen, okay? B, not D, B, dress Mr. Jackson's left arm first, and the left arm was the weak arm. C, dress Mr. Jackson's right arm first. Or D, dress Mr. Jackson whatever way is easiest. And so if someone's left arm is weak and the right arm is strong, if you start dressing with the strong right arm first, usually when you get around, there's not enough room to get that left arm into the sleeve. So whenever someone has a weakened extremity, we usually dress the weak extremity first. And so the answer for this, again, it shouldn't be two D's. The answer is going to be B as in boy. You're going to always dress the affected arm first to prevent injuries. 23, you're asked to assist Mrs. Johnson. What name should you call her? A, Mrs. Johnson, B, ma'am, C, Mrs. J, or D, Mrs. And it's going to be A. Always show respect for your resident by calling them their given name. And then what I'll normally do is I'll ask them how do they want to be addressed, because sometimes they don't want to be called Mrs. Johnson. But for that first initial encounter, you call whatever's on the chart until you've been told otherwise. 24, your resident asks if she could have a moment to pray before her meal. You should A, let her know that her meal cannot wait. B, tell her she needs to eat before the meal becomes cold. C, provide her with a private moment to pray. Or D, ask her to wait to pray at bedtime. And we know our CNAs are super smart, super compassionate, and super caring. So the answer is C. You're going to show respect for a resident's spiritual needs. This is an important part of a CNA's job. So you're going to give her time to pray. 25, let's see if you remember this. The normal adult respiration rate is A, 5 to 15, B, 20 to 30, C, 15 to 25, or D as in dog, 12 to 20. What is the normal adult respiration rate? And if you said D, between 12 to 20 breaths per minute, you're absolutely correct. Great job. Right, 26, you all. Your resident is incontinent of urine. You should chart every time and you have to think about what incontinent means. For a lot of our CNA students, they think incontinence means retention. And it's not that the person's retaining urine. This person actually cannot control when they urinate, so they're wet. So your person who's wet with urine, you should chart every time A, urinates, B, wets the bed, C, takes in fluid, D, asks to go to the bathroom. Right, and so it's a little bit torn between A and B, but she could have wet the bed with water. So I want to be very specific. I'm going to chart every time A. When a resident is incontinent, they are unable to control their bladder. It's important to chart when they urinate, not just when the bed is wet, because you could have urinated 4 times, but the bed, because you didn't get there quickly enough, the bed has been wet for 4 hours. And so we want you to document every time the resident urinates. 27. An employer must offer a CNA a free vaccination for A, the flu, B, hepatitis C, B hepatitis C hepatitis B, or D AIDS. All right, and so this one is a little tricky because I know your facilities usually offer flu vaccines, but according to OSHA, employees must make hepatitis vaccinations available to workers who work in high-risk environments. So by law, especially if you work at a hospital or a nursing home, your facility will usually have you sign a paper saying that you either will approve to have a hepatitis B vaccine or that you decline it because it's contagious. 28. Which statement about canes is true? A cane can support all of the resident's weight. B, canes do not help with balance. C, canes are only used when a resident cannot support any weight. Or D, a quad cane has 4 rubber-tipped feet. And the correct answer is D. A cane is helpful to a resident with a weak leg. The cane helps support weight and helps with balance. And if you think about a quad cane, it literally has 4 prongs on the bottom, and those 4 prongs are evenly spaced. And so it's going to provide a wider stance or a wider base of support so your patient will be more stable. 29. How often are state inspections done in the facility? A, every 9 to 15 months, B, every month, C, every 6 months, or D, once a year. State inspections. And the correct answer is D. According to Medicare.gov, state survey agencies conduct nursing home inspections once a year, and of course more frequently if there's been a violation or a complaint. 30. The proper medical term for high blood pressure is cyanosis, hypertension, dysphagia, or D, hypotension. Okay, and I do want to just cover some prefixes for you. When you see the word cyan, C-Y-A-N, it usually means blue. When you see the prefix hyper, that means something is elevated or high. When you see the prefix dys, that means something is painful. Right now, my throat doesn't hurt, but you can tell there's a change in my voice. And so, but if you heard a person who was speaking out normally, if you know what they sounded like previously, you would probably think, well, maybe they have dysphagia, maybe they may be difficult for them to swallow. Hypo, the P-O, think of someone who's poor. So when someone is hypo, their funds are low. All right, so hyper is high, hypo is low. So let's go back. The proper medical term for high blood pressure is, we know it's not A because A refers to turning blue. We know it's not C because C refers to pain because it says DYS. We know it's not D because hypo means low. So the correct term must be B, hypertension. And that's a term that we'll use if a person's been diagnosed with high blood pressures. That means their systolic blood pressure is greater than 140 and their diastolic is greater than 80. 31, when a resident is being admitted to a facility, which of the following should you observe and record? All right, so this is during the admission. A, the family history. B, any resident complaints. C, any broken skin, cuts, or bruises. D, the resident's I and O's. All right, so what's going to be really important for you to document when you're first encountering a resident? And that answer should be C. At admission, any marks that are observed on the resident's body should be recorded so that they later will not be mistaken for the resident being abused in the facility. And of course, your nurse should be documenting too, but as a CNA, your documentation is just as important. 32, when does restorative care begin? When does rehab begin, you all? A, as soon as possible. B, after a week of bed rest. C, when the resident decides to begin care. D, when the family decides to begin care. Well, some patients are non-compliant, so they're never going to decide to begin care. So we want you to be thinking about getting that person better as soon as possible. So usually discharge or rehabilitation starts on admission. Right? So A, it is important to begin restorative care as soon as possible to prevent any further complications. 33, and we're almost done. We have 70 questions total, and we're halfway there. 33, encouraging a resident to take part in their own personal care, such as eating and bathing, is A, against a resident's rights. B, necessary for rehabilitation. C, the family's responsibility. D, the charge nurse's responsibility. Why do you want to encourage this person to participate in their own care? B, rehabilitation should be part of patient care. You encourage them to do as much as they can, as often as they can. 34, when assisting a resident into a wheelchair, the nursing assistant's first step is to check A, the floor for clutter. B, if there is a gait belt. C, if the wheels are locked on the wheelchair. C, if the resident is cold. This is specifically referring to the wheelchair. So what should you do first to the wheelchair? C, before transferring the resident into a wheelchair, it is important to be sure that both of the wheels are locked. This will ensure a safe transfer. 35, a cold application is usually used to A, reduce swelling. B, help prevent shock. C, help increase blood flow. D, help cool down the area. All right, so a cold compress, when you think about rice, like after a sports injury, that's rest, ice, compression, and elevation. Okay, and so when we're trying to reduce swelling, we will use a cold application. So the best answer is going to be A is an apple. A cold application can constrict blood vessels, all right? So it's going to decrease blood flow to that area. Therefore, it decreases swelling. Usually, we don't keep a cold compress on for longer than 10 minutes. And you always want to make sure that if you have a cold compress, you have it covered with something, because we don't want to put a cold gauze or whatever it is directly on the patient's skin, because we can actually cause frostbite or injury. So usually it's going to be some type of cold application that's inside of a baggie, some type of protective device, maybe, I won't say a washcloth, but if that's all that you have, a towel, you can use that also. And then you apply that to the resident's skin for no more than 10 minutes at a time. 36, when filling out an incident report, the CNA should A, document anything she heard about the incident. B, file the report in the resident's chart. C, only document objective information. D, only document subjective information. Right, so to know the difference between objective and subjective is really important in your documentation skills. Objective is real and factual. Subjective is how I felt about a situation. Okay, so when we're documenting, we want to do C. Objective information is factual information. On an incident report, only document factual information that you observed. For example, if you found a resident on the floor, you cannot put in your notes that the resident fell to the floor. You would document as a CNA that the resident was found on the floor, and then you could put that the patient states that she slipped to the floor because she didn't have her shoes on or whatever the case may be. But what you saw would be actual objective, and what the patient states at this point would be the subjective. 37. Which of these is considered a resident's right? A. Private communication with mail and phone calls. B. Having medical information kept confidential. C. Privacy while receiving a physical exam. Or D. All of the above. So which of those are a resident's right? And the correct answer is D. Providing privacy for a resident is important consideration at all times. So whether they're on the phone, they're talking to their doctor, they're taking a bath, protect their privacy. 38. Urination is also called A. Wetting the bed, B. Defecation, C. Voiding, or D. Bowel movement. And I'm going to help you out. Defecation is the act of having a bowel movement. So it's not B and it's not D. Urination is also called C. Voiding. So urinary voiding is the process of removing urine from your body. And of course, when we go to the restroom, we're not wetting the bed. We void into a commode, into a toilet. So that's why the other answer option wasn't the best. 39. While dressing Mrs. Watson, she complains of a sore spot on her calf. You should A. Finish dressing her and say nothing. B. Stop dressing her and ask a charge nurse to check the spot. C. Rub lotion on her calf. D. Apply a cold compress to the spot. Her calf hurts, so that's a change in condition. All right, so it's going to be B. A sore or ache in the calf could indicate a blood clot, and the charge nurse should be informed immediately. So you would not be rubbing or massaging that area because you could dislodge the clot and it could travel. If it travels in the eye, it can cause blindness. It travels in the lung. We call it a pulmonary embolism. Travels in the brain, that's going to be a stroke. And of course, if it travels to the heart, they can have a heart attack. So we want to pretty much put that person in bed, they're on bed rest until we can figure out what's happening with their leg and why it's painful in their calf area. 40. The resident is using a walker. His elbows must be A. Bent at a 45-degree angle, B. A 50-degree angle, C. A 90-degree angle, or D. A 15-degree angle. Whenever a resident is using a walker, their elbows are only slightly bent. So the one that's going to provide the least flexion is going to be D as in dog. A 15-degree angle creates the best balance between the resident and the walker. 41. When a resident is receiving force fluid treatments, you should offer residents every hour. Provide only high protein fluids. C. Provide more than 1,000 cc's of fluid per shift. Or D. None of the above. So force fluids. This person's dehydrated. What should you do? Yep, and I already gave you the answer. A, fluids need to be encouraged on a regular basis throughout the day. So you want to be asking them about, encourage their water intake, their fluid intake at least once per hour. And then you always want to follow the documented care plan for the resident. So when it said give 1,000 cc's or whatever, that may be a little too much, especially if the person also has IV fluids going. So you as a CNA, your job is to keep the water pitcher filled. And every time you go in, just encourage that person to drink some more water or to give them maybe something that they would like to drink. Be careful with caffeinated drinks because caffeinated drinks have diuretic tendencies, which means that if you give me a cup of coffee, it's going to make me void. It's going to make me urinate. So I'm going to be pulling out the fluid that you're trying to replace. So usually it's not going to be any caffeine. It can be maybe some juices or it can be just regular water. 42. If a resident has not had a bowel movement in several days, he may complain of A. Nausea, B. Decreased appetite, C. Abdominal cramps, or D. All of the above. All right. So if your person is constipated, what are they going to complain of? D. All of the above. It's important to always document and report all of the resident's symptoms relating to any condition. So if someone is constipated, they haven't been having a bowel movement, as a CNA, your job is to increase fluids, increase activity, and check with your nurse first. You want to see if maybe you can get some prune juice or some prunes. And if you give them a whole bunch of fiber without fluids, fiber is going to bulk up the stool, but it's just going to constipate them more. So you just can't give them a whole bunch of total with milk. You need to give them some total with milk and then also some water. And hopefully that's going to help move the bowels. 43. In what manner should a CNA report care given to a resident? A, by entering it into the resident's chart. B, by telling the charge nurse. C, by reporting to the next CNA on duty. D, by reporting to the DON, that's the director of nursing. So that's the person who's over the entire unit. How should you report care given to a resident? Legally, we need to write it down. If it is not documented, we have no proof that it's been done. So A, all care given to a resident must be documented in the resident's chart. 44, a resident that is mentally ill is likely to A, live in their own fantasy world, B, have feelings of fear and anxiety, C, believe they are someone other than themselves, or D, all of the above. When someone has mental illness, it's going to be D. Mentally ill residents may often have irrational feelings and concerns regarding their well-being. And so you still want to treat them with respect, and we still want to listen to them. But you also, want to fully understand that they sometimes are in their own world, and they can become agitated or anxious very quickly when we try to reorient them. 45, a resident has a decreased appetite. He should be offered A, a bland diet, B, high-protein milkshakes, C, dietary supplements, or D, only the foods that he likes, right? And so when someone has a decreased appetite, we want to order or at least offer dietary supplements because they contain vitamins and minerals to help maintain good health. And so usually these are very specific to the patient's needs. If they have a respiratory condition, there's a dietary supplement called Respiror. If they're a diabetic, we don't give them Boost because Boost contains sugar. We give them the diabetic version, which is called Ensure. So it's very important that if you notice your patient isn't eating, that you work with the nurse who will then contact the doctor, and we get the dietary supplement that is specific to that patient's needs. If we're not careful, we can be giving somebody who has kidney failure a supplement that has potassium, which means that they would have to go to dialysis more frequently, and we could be causing a major medical issue. 46, which of the following is considered caring behavior to the resident? A, working fast and efficient. B, helping the resident with patience and understanding. C, only helping when asked. D, coming to work on time. All right, so caring behavior towards the resident. B, a CNA's job is to observe what the resident may need, so we need you to be proactive and be available when the resident needs help. A CNA must be patient when helping the resident. 47, you've been asked to shave Mr. Jackson's face. It is important to A, use Mr. Jackson's approved shaving products. B, shave the cheeks with an upward stroke. C, use betadine, or it should be betadine, or Nix. And then D, a CNA is not allowed to shave anyone. So when you're shaving someone's face, think about the different skin types and skin conditions and the coarseness or the thickness of the hair follicles. The answer is going to be A. Always use the resident's personal care products unless specifically directed not to by the charge nurse. 48. One of the best ways to help prevent a decubitus ulcer or bed sore is to A, apply lotion to any red spots. B, change the bed linens every day. C, reposition the resident every 2 hours. Or D, encourage the resident to drink plenty of water. How do you as a CNA prevent a bed sore? And if you said C, repositioning, you're absolutely correct. Very good. All right, and then don't forget, if you have not already subscribed to our channel, go ahead and do so. My name is Eunice Mathis. I'm a registered nurse and the owner of Florida Training Academy, and this is what I do all day, every day. I help future CNAs, future nurses get to the next level, and so we usually have about 2 videos that we post per week specific for CNAs, and we just love to have you as part of our family. All right, so 49, Mr. Blake is confined to a bed. You are assigned to Mr. Blake. You are assigned to help Mr. Blake with his lunch. What position should Mr. Blake be in before he eats? A Sims position. Sims is usually a sideline position that we'll use whenever we're going to be giving a patient an enema. And as a CNA, you may not be giving medication, but when I say, hey, Leslie, I got to give Mr. Blake an enema. You want to get him on his side, put a whole bunch of pads under him. And if you leave him on his left side, it's going to be easier whenever I give the enema. It's going to be able to travel further, through the colon. So Sims, think of the enema position. Even though you don't give the medication, you do help the nurses with the repositioning. B, reverse Trendelenburg position. So I know what Trendelenburg is, so reverse is the opposite way. That just sounds strange. We know that's not the answer. C, a lateral position. Lateral is side lying. Are you going to put someone on their side before they eat? And then D is Fowlers. When you think of Fowlers, think of somebody who's sitting up. They may be semi-reclined, but usually Fowlers is anywhere from 30 up to 90 degrees. And we encourage our CNAs here at Florida Training Academy to get that patient all the way up so that they're less likely to aspirate. So the best answer is D. All right, and here it says 45-degree angle or higher, but remember, you get to help, you get to control. If that person can't sit all the way up, use pillows to help them sit up because it'll help them prevent aspiration. 50, the requirements for nurse aides in long-term care facilities are to complete a nurse aide educational course and a competency evaluation. These requirements were set by A, the FDA, B, OBRA, C, the CDC, and then D, OSHA. And so we know the ones who set the rules for the nursing homes, the long-term care facilities, was B. All right, it was the Omnibus Budget and I think it was Reform Act. I do apologize for said that incorrectly before. I think before I put Reconciliation Act. 51, Mrs. Watson sprained her ankle. A cold application is being applied. It is important to observe the resident for possible signs of A, fatigue, B, dizziness, C, cyanosis, or D, redness. All right, so if we keep a cold compress on the skin for too long, what do you think is going to happen? And it's going to be C. Cyanosis is a sign of poor circulation and could lead to tissue death. Stop treatment at once and report the change to the charge nurse. 52. The best way to keep a resident's personal information confidential is to A, keep a resident's medical information private, B, only share information with those involved with the resident, C, never share a resident's medical condition with your friends, or D, all of the above. All right, and I know that you're smart, and we know it's all of the above. Only those involved in the resident's care are allowed access to the resident's medical and personal information. 53, the term up ad lib means the resident is is independent with balanced periods of rest and activity. B, is assigned to complete bed rest. C, must not perform any ADLs, activities of daily living, alone. And then D, must eat all of their meals in their bed. So when someone is up ad lib, they're independent, all right, but you do want to monitor them and offer assistance whenever needed. So A, this is an activity order that suggests the resident performs their ADLs. And what does ADLs mean? Activities of daily living independently with periods of rest as needed. 54, we get to do some math. The resident is given a glass that holds 320 cc's. The resident drinks 1/4 or 1/4 of the glass. What amount will the CNA record? All right, so we have to divide 320 by 4. And that answer is going to be C. It's going to be 80 cc's. 55. The CNA finds a roach in a resident's room. The CNA should A, place a roach trap in the room. B, report it to housekeeping immediately. C, ignore the roach. Everyone has them. D, tell the resident never to walk barefoot. So if you see a bug in your resident's room, you want to notify housekeeping because insects carry diseases and it is unacceptable for insects to be found in a healthcare setting. 56. Mr. Jackson complains of numbness on his left side. His grip is weak and he is slurring his words. You should A, check back with the resident in an hour to see if his condition has changed. B, call 911. C, notify the charge nurse immediately. This may be a sign of a CVA, which is cerebral vascular accident or stroke. And D, notify the charge nurse when you have time. Anytime there is a change in a resident's condition, your answer is always going to be to notify that nurse. So the answer is C. The CNA must always report to the charge nurse any unusual signs or symptoms that she may observe as soon as possible. 57. When giving oral care to a resident, the CNA should always A, use dental floss, B, remove oxygen before brushing, C, wear gloves, or D, all of the above. So when you're performing oral care, what do you have to do? The correct answer is C. All right, let's talk about that, removing the oxygen. Removing oxygen is not necessary when brushing the teeth. Remember, sometimes the oxygen is in the nose, or they could have like a simple mask on. You could either lift the mask or leave the nasal prongs in place. However, the CNA must wear gloves when providing mouth care to reduce the risk of contamination. 58. Mr. Jackson is having trouble swallowing. He may be suffering from incontinence, insomnia, dysphagia, or influenza. Right? So when someone is having trouble swallowing, we call that dysphagia. So dysphagia or dysphagia is the medical term for swallowing difficulties. Some people with dysphagia have problems swallowing certain foods or liquids, while others can't swallow at all. And that's usually when we'll start modifying their diet, or we may end up making them NPO. 59. The CNA is shaving Mr. Jones and accidentally nicks him. What should she do? A, report the incident to the charge nurse. B, ignore the nick and continue shaving. C, call a doctor. D, put a Band-Aid on the nick. And this is a change in the patient's skin condition. So we're going to report that injury to the charge nurse right away. And maybe we don't need to be shaving him with a regular razor. We need to encourage that family member to bring in an electric razor. 60. Mr. Peters is going to the dentist in the morning. He states he is not anxious about the visit, but he is pacing and unable to stay calm. The CNA should A, insist that he goes back into his room and calm down. B, ask other residents and staff members to calm him down. C, realize by Mr. Peters' body language that he is agitated about the visit and ask the charge nurse to speak with him. D, call Mr. Peters' family and ask them to speak with him. All right, so we want to be proactive. We don't want Mr. Peters getting to the dental office and then they can't even perform this procedure because of his anxiety. So we want to let that nurse know about it. So the answer is C. Regardless of what a resident may say, their body language can convey the truth about their feelings. Never ignore a resident who appears upset. All right, we only have 9 more to go. Number 61, everybody. Mr. Johnson's son has passed away recently. She continues to talk about him and waits for him to visit each day. She is experiencing A, acceptance, B, anger, C, depression, or D, denial. Okay, and the answer is D. Although the resident may be experiencing such things as anger and depression over the death of her son, she is in denial if she's still waiting for him to visit each day. So you do want to allow them to express their emotions, to talk about their son. And if you want to, you can speak with the nurse because we do have case management, we have counselors, and she may need to be speaking to someone, maybe like a psychiatrist. 62. When muscles atrophy, they become A, smaller, B, softer, C, larger, or D, harder. Muscle atrophy. And the answer is A. Muscle atrophy or wasting means the muscle is getting smaller. To prevent this, a resident will be prescribed range of motion exercises to help keep the muscles from weakening. Remember, if you don't use it, you lose it. 63. Huntington's disease can be recognized by A, aggressive behavior, B, strange body movements, C, heavy perspiration, or D, fatigue. And I have a picture so that you'll be able to recognize Huntington or a person with Huntington's disease. And because of the neurologic concerns, and they're going to have muscle loss, and so they're not going to be able to control their body movements. So the most common sign of Huntington's disease is the inability to control one's body movements. And here we have a resident who has the disease, and he's shown in the picture, and looks like he's either in a geriatric chair or a wheelchair. 64, before giving care to a resident, you should A, put on your gloves, B, get out all the supplies you need, C, change the resident's sheets, D, check the identification of the resident. All right, so which is going to be the safest? What do you need to do first? And the answer is D. You must always check the identification of the resident before giving care. If you give care to the wrong resident, that is your responsibility. So we want to make sure that we're giving the right care to the right person at the right time. 65. Mr. Jones is looking sad and sitting in the corner all alone. You should A, and it's Mrs. Jones, excuse me, leave her alone and don't bother her. B, tell her she must participate in activities. C, sit down with her and ask what is wrong. D, assume she is sad because her children are not visiting today. So if you see somebody sitting all alone and you are a compassionate CNA, you're going to see. You're never going to assume you know what is wrong with the resident. You're going to stop, take time, and ask the resident what you can do to help. 66. A common sign that death may be approaching is A, decreasing body functions, B, severe body pain, C, severe fatigue, or D, unresponsiveness. All right, so death may be approaching whenever someone is admitted to hospice. Usually, they're not going to be as arousable. Well, let me backtrack. In-stage hospice, because you have patients who are still ambulatory who may be under hospice care, but when they're in stage, usually they're not going to be as alert. They're not going to be hungry, so they won't be wanting to eat. They're going to have less urine production, and they're probably not going to have a bowel movement. And so their body functions start decreasing. So as I already told you, the answer is going to be A. When death is near, circulation slows and normal body functions decrease. And our goal is to provide palliative care, and that's to keep them comfortable during that time. 67. Which is a correct statement about fire extinguishers? A, never use a fire extinguisher in a closed area. B, CNAs are not required to use fire extinguishers. C, certain fires should only be used on certain type of fires. Certain fire extinguishers should only be used on certain types of fires. And then D, all fire extinguishers are the same. Okay, we know D is not the answer. It is going to be C. Right? And so all fire extinguishers are not the same. You will be trained in your facility on how to use a fire extinguisher and which fire extinguisher ought to be used on which type of fires. And remember to pass. So pass stands for pull. You're going to pull the pin. You're going to aim towards the base of the fire. The first S is to squeeze. You want to squeeze the nozzle. And the second S is to sweep side to side at the base of the actual fire. So what does pass stand for? Pull, aim, squeeze, and sweep side to side at the top of the fire? No, at the base of the fire. Very good. All right, 68. When you enter Mr. Blake's room, you notice a CNA pushing Mr. Blake onto the bed. You should A, keep it to yourself, B, report it immediately to the charge nurse, C, tell the CNA not to push Mr. Blake, or D, check on Mr. Blake later to see if he's okay. And we are mandatory reporters, so the answer is going to be B. You need to report that to the charge nurse. So any incident of resident abuse must be reported to your supervisor. 69. You're helping your resident learn to use a walker. It is important that you, A, let him learn on his own to promote independence. B, only help him if you have time. C, pat the floor around him in case he falls. D, stand behind him and use a gait belt. All right, so which sounds the safest? And the safest option is D. You're going to stand behind the resident while holding the transfer belt. That will promote safety for you and the resident in the learning process. All right. And then lastly, number 70, urinary retention refers to A, incontinence. And I already told you, incontinence doesn't mean retaining. Incontinence means they can't control it, so they're actually wet. So urinary retention is not incontinence. All right, so B would be normal amount of urine output. C would be the inability to urinate. Or D, urinary retention refers to a large amount of urine. And the correct answer for 70, when someone's retaining, right? So if it was fecal retention, we call that constipation. This is urinary retention, so it must be C. The person cannot urinate, all right? And so if a resident's retaining urine or unable to urinate, it should report it to the charge nurse as soon as possible. And some of the symptoms or signs that your patient may be complaining of could be like lower abdominal pain, or you could actually see like bladder distension. So everybody, guess what? We have completed 70 practice CNA questions. We have playlists with questions, with skills, if you need help with CPR. We also train some of the best American Heart Association CPR, BLS, ACLS, and PALS instructors in Florida and also around the world. So we do hope that if you have any questions, just leave us a few comments below. And thank you all for bearing with my voice. But I'm just so happy to, be 3 days after surgery, able to go back and do what I love, and that's train my baby. So you all have a blessed day, and I'll see you all in the next video.